Hello, scholars. I hope you're all doing well. In today's video, I'll be giving you a brief overview of type 5 diabetes, which is also referred to as malnutrition-related diabetes mellitus, MRDM. Malnutrition-related diabetes mellitus, also known as type 5 diabetes, is a distinct form of diabetes that develops primarily due to prolonged poor nutrition, especially when the body lacks sufficient protein and calories. Unlike type 1 and type 2 diabetes, this condition is mainly seen in regions where malnutrition is common due to poverty. Distinct from type 1 and type 2 diabetes, malnutrition-related diabetes mellitus, MRDM, is considered a separate category because it does not share the same underlying causes or characteristics as type 1 or type 2 diabetes. Key cause chronic malnutrition. MRDM mainly develops due to long-term nutritional deficiencies, particularly a lack of protein and calories, which damages the pancreas and disrupts insulin production. More common in resource-limited settings, this condition is frequently found in developing countries or regions where food insecurity and limited healthcare access are prevalent. Usually starts in younger people. It often affects teenagers or young adults. Lean body frame. People with MRDM are usually underweight or have a low body mass index, BMI. Rarely develop ketosis. Even without insulin, they usually don't develop diabetic ketoacidosis, a dangerous complication common in type 1 diabetes, divided into two subtypes. Fibrocalculous pancreatic diabetes, FCPD. This involves damage to the pancreas, often with calcification, hardened areas in the pancreatic tissue. Protein-deficient pancreatic diabetes, PDPD or PDDM. This form is mainly due to a lack of protein in the diet, which affects the pancreas over time. Why does malnutrition lead to diabetes? Damage to beta cells. Beta cells in the pancreas are responsible for making insulin. Chronic malnutrition can cause permanent changes in these cells, reducing insulin production. Insulin resistance. Malnutrition can also make the body less sensitive to insulin, so it doesn't work as well in controlling blood sugar. Lack of essential nutrients. Deficiencies in certain vitamins and minerals, like zinc, magnesium, and vitamin D, can negatively affect how the body handles sugar and contributes to the risk of developing diabetes. Diagnosis, treatment, and prevention of MRDM. Diagnosis can be difficult in poor healthcare settings. Identifying MRDM can be challenging because it requires careful assessment and exclusion of other types of diabetes. Treatment focuses on nutrition and insulin. Managing MRDM involves both treating the diabetes, often with insulin, and improving the person's nutrition to address the underlying cause. Prevention through better nutrition. Preventing MRDM requires improving the overall nutrition of communities, especially in children and adolescents, through public health programs, education, and access to healthy food.